Welcome back to Tell Me More with me, CJ Quartlbaum. Tell Me More exists to help bridge the gap in our intergenerational workplace dynamics and build better leaders. But we also like to talk about the future. Another fun thing I get to do is interview and talk to very interesting people. And today, I get to be joined by a woman who has an incredible story and is doing incredible work in this world, Kim Downey. Kim, welcome to the podcast.
Thank you, CJ. I'm honored to be here.
I can't wait for this conversation. I think the people are going to love you. Kim, tell me, who are you? Where are you from? And what do you do now?
Sure, I'll give you a brief version. I'm a pediatric physical therapist by training, and I was working in a local elementary school, and I developed thyroid cancer. So I had surgery in November of 2020, and 3 of my parathyroids out of the 4 were inadvertently removed, and the 4th one never kicked in, which caused a series of complications with calcium regulation and kidney function, and we thought my vocal cord was paralyzed. I needed radioactive iodine because the tumor margin was positive. So what I thought, my thyroid was going to be removed and I was going to walk back to my regular life. It turns out it was just the very beginning. So I had a series of complications through the summer and I blacked out, fell and hit my head. Turns out I had Lyme disease, a concussion, thoracic outlet syndrome, a whiplash injury, and a broken toe. I went to 4 months of physical therapy, had a great PT, had me in good shape December 29, 2021. Unfortunately, the next day I was back on the operating table because we just found out I had breast cancer. So then I had surgery and a month of radiation for that, and I needed another MRI, and I had breast cancer on the other side. So I needed surgery and a month of radiation for that. So it was really 2 straight solid years of constant medical issues. And what I finally thought was going to be a routine imaging visit, I showed up and my radiologists have been incredible. I've actually written a Kevin MD article about him and recorded a podcast. And I was looking forward to seeing him. And I got there and he wasn't there. And I asked where he was, and they said he died a month ago. And I could not believe it. I actually said, "Are you joking?" And they said no. And I asked what happened. And they said the family hasn't shared that. And I fell apart. I couldn't stop crying. I couldn't stop shaking. My arms and legs went numb. In that moment, I knew in my heart that he had taken his own life. And I found out that was the case. And I felt a calling to support doctors. So for the past couple years, that's what I've been doing from the time I wake up till the time I go to bed.
What a story. 2 years of just the constant medical issues and the back and forth. And then to find out that one of your doctors took their own life. I imagine that for you in that time, what were you feeling?
Well, I'm a positive person by nature, and generally in my life, I've been very blessed. And I would say, I guess you can use the term well resourced. I have wonderful friends and family, and I had a good career, and I feel like I've had support. So, at other times in my life, like before my son was born, I had had a couple miscarriages, and that was really hard for me, and I felt like I handed it though in what you might say, I don't know, a typical or an expected fashion. And then I watched my dad take his last breath in 2017. And again, that was quite traumatic. But each time I felt like, I don't know if the word bounce back or move forward, any of that is right. But again, at those times in my life, I was well resourced. So I think what happened is when I started this whole journey, I again was well resourced. So I kept thinking, okay, one more thing and I'll be done. One more thing and I'll get back to my regular life. And I kept trying to bounce back or move forward. But that day, because on top of that, the radiologist did find something else that day that was moderately suspicious for cancer, and I needed another biopsy. And those hurt, right? And I had been through so
Yeah.
much. I had a number of biopsies, and I've been scanned from head to toe, inside and out. And I remember what flashed through my brain is if she only told me I had a week to live, I wouldn't be any more upset. Between it was mostly the fact like what I thought was finally going to be moving forward was the worst of my life. And I even remember thinking I would take cancer again if it could have brought my doctor back. Like I didn't know how to feel better, and I just wasn't in a great place inside.
So hearing about your doctors spurned this work that you do now in caring for other doctors. What does that look like?
So interestingly, the spring of 2022, before, so my surgery was like December 30th, 2021. A few months after that, I was an average Facebook user. That's the only social media I was on. And Dr. Michael Hirsch is a GI doctor in Chicago. And 4 months prior, he had started a blog, A Better Physician Life. He also has a coaching business for physicians. So I said, I think I told you in our initial conversation that it was like God or the universe, put his blog on my Facebook feed. And I clicked on it, which is interesting too, because it had nothing to do with me. So it might have showed up a few times and I might have been like, what is this? And he wrote a great blog for a year, and he would attach music videos, and he nailed it. So every Wednesday I would go to his website and read it. So after my doctor died in October 22, I was just so devastated. In that December, Dr. Michael Hirsch shared he was celebrating his year of blogging. So again, randomly, I sent him a private Facebook message to Better Physician Life, just congratulating him and sharing how much his, work resonated with me. And then he sent me the nicest message back, and we kept communicating. And then I said I thought maybe I'd feel better if I told him the story about my doctor, and he said, I'd love to talk with you. So New Year's Eve morning of 2022, we had a conversation, and we kept going, and he started coaching me. And then he connected me on LinkedIn the spring of 2023 because I wanted to reach out to more doctors to see if they could help me find a way to help my own doctor, because I had been trying to make an inroads with my local healthcare system for a year and hadn't been successful. So in my conversations with other doctors, they were telling me that they felt like I was meant to make a bigger impact, and you can make a bigger impact outside the system. And I didn't want to hear that at all. I'm like, I don't care about that. I just want to help my very own doctors. But then I started helping them. And then as I would talk to them, I would think of other doctors that they would want to know. So then it ended up even around the world. So now I know doctors in New Zealand, Australia, a group of doctors in the UK, and we're heading there in the fall, and I'm going to meet up with them. So people told me I should start a podcast. So I started a YouTube channel where I connect even more doctors. I have over 100 episodes. It's not all doctors. It's others that intersect with healthcare. And so that I have the YouTube channel, and then I started a Substack newsletter. So I share monthly updates on what I'm doing. And because Michael's page showed up on Facebook, Kevin MD, social media's leading physician voice, he showed up on my Facebook, I believe. And when I was sad about my radiologist, Michael Hirsch said, take a day and write about him. I did. He said, this is really good. You should submit it to Kevin MD. So I did. It was accepted. That was my very first published article, my very first podcast. I did one then about coaching and Michael. And then doctors started reaching out to me. And now I'm on Kevin MD every month on his podcast. I've collaborated on over 24 articles. And then the first 20 episodes, 15 episodes of my YouTube channel, we've just turned into a book. It's the first Stand Up for Doctors book one. It's called White Coats, Courageous Hearts, True Stories of Doctors Reclaiming Their Humanity in a System That Challenges It. And Dr. Kevin Poe wrote the endorsement on the back, and Dr. Michael Hirsch writes the foreword. And it's just really beautiful. So that's what it looks like right now.
That's really great. You're providing a space for doctors to talk about their needs. I think often we look at our healthcare providers and we don't think, you probably need someone too. When we first talked, you shared a really interesting stat with me about the number of doctors who commit suicide every year. Can you share that with the people?
Well, I think it's a very outdated number, but they say that just in the United States, over 400 doctors die by suicide a year. And I think that's probably vastly underreported because also some you don't even know, like some could be disguised in a sense as something else and it might not be known, or sometimes families don't choose to share that. But that's just in America, and that's over twice of the average population. And then I also just read a statistic this weekend that 1 in 6 doctors have either contemplated or attempted suicide, and that's just unacceptable. It's horrible and it's unacceptable.
In your conversations with doctors, have you found out some of the underlying reasons why this is so prevalent amongst them?
Yeah, so through all the so now I've spoken with 100 conversations, and what I've come to put all together is that it starts in med school even, and the culture of medicine has to change. And also you take like young, smart people who want to help other people. So even in high school, sometimes they start neglecting their own needs or don't do things for fun or don't go out for a team because they want to get really high grades or get in the volunteer hours at a hospital to get into the best college and then to get into the best med school. And then because of this, they also start competing with each other. So instead of like collegiality, they are kind of set up to compete against each other. And then for the best residencies, because there might be a doctor who from the time he was 5, like wanted to be, say they saw had a relative have like orthopedic surgery with a great outcome and they want to be an orthopedic surgeon. Well, there's only so many spots for any specialty because just you want to be an orthopedic surgeon, even if you get into med school, doesn't mean you can do that. So if you don't get that spot, then you might have to choose another specialty. Now we desperately need primary care doctors. They're, I think, the glue that holds things together. But if you wanted to be an orthopedic surgeon and the residency you get into is primary care, like that's that, but you've already spent all the money in for med school. So then before you even start, you might be in a specialty that you didn't feel was meant for you. And then just in residency, they didn't used to have a limit on hours. So many of the doctors I talked to have worked as many as 120 hours. And they're taught, like you have to be perfect. You can never be wrong because it can cost a patient their life. But who in the world can be at their top form after they've been awake for 36 hours? And then even again, if they are doing surgery or just whatever, if they're on call and really busy, they're taught to suppress their own needs. Even basic things like they'll go 12 hours without eating, without going to the bathroom, and again, over 24 hours without sleeping. So then later, even if they're an attending and have more like shift work, that they've lost a sense of themselves because they had to drop away all of their hobbies. So they don't even know how they feel about things. And they're also trained to, be professional and set up a wall between the patient. So what I've also learned, so say in the moment, if they're running a code, you don't want your emotions to take over. You have to do what you need to do to save a life. But then they have to walk into the next room with maybe somebody with a sprained ankle where they might have just tried to save a baby that died. So if they never unpack that, it can cause a lot of problems in their personal and professional life. So those are a couple things.
I never understood why doctors would be forced to work these incredibly long shifts where I'm like, I think I want the person who's responsible for taking care of me to be at top form. This doesn't feel like top form if you're on a 36 or 48-hour shift. So what does advocacy for doctors look like around things like this?
Right. Well, I'm hoping that these conversations will make a difference, and I'm still trying to figure that out. And that's part of the reason I wrote this book. So, in part, it's for doctors because, 15 doctors contributed their like honest, raw stories. So, when doctors read it, they're going to feel seen and heard and validated and say, this is me. And sometimes even realize like what they might not have thought was trauma is really, trauma. So for doctors, it'll feel like, yes, we're getting our stories out there. This is really what it's like. Other people need to know. And for, patients and lay people, we need to know that doctors are struggling because everyone wins when physicians are well, and physician advocacy equals patient advocacy. So if we can resource our doctors so they can be healthy and well physically and emotionally, and if we can help change the system so they're not forced to see patients every 10 minutes so they can give the patients the care they want to, then the patients win. So that's the importance, of this work. Is I feel like I'm part. So my mission statement is to build connection and create advocacy for healthy doctors. So doctors have felt so siloed and they've struggled in silence. A lot of these things, especially before the pandemic, they never talked about. But then it got so bad there, it kind of broke things open. And now a lot of doctors are more willing to talk about their struggles or to seek help from a therapist or a coach. And then, but also again, if only the doctors go to the voting booth, to try to change things, if some of it needs to be done on a, like systemic or political level, then we're really in trouble, right? So that's why other people need to know and care and to support our doctors. And speaking to the work hours, is they and some years ago they did make an 80-hour work limit for residents, but that's still twice. Like, imagine how exhausted the average person is after working 40 hours a week. And just one example I'll share is, say you have I have a friend whose son was doing like a pediatric residency in the NICU, the neonatal intensive care unit. So can you imagine if it's your 79th hour, right? Or if you've been awake for 36 hours and you're making life-altering decisions for teeny tiny premature babies and ordering the medications, that just the very slightest dose off and the baby can die. So there's really impossible expectations are placed on doctors to be at their top form after working 79 and a half hours a week or 36 hours in a shift. And we all need to care because patients die when mistakes are made, but doctors can't be, nobody in the universe is perfect. And we expect perfection, impossible perfection of our doctors.
Yeah, this is fascinating because every doctor I know is always tired. And I'm often thinking, what does it look like for you at that 79th hour to have an emergency come across your desk? How do you put forth your best self? What's going on in hospitals that there hasn't been more thought just in changing the way that we do things?
That's a very good question. And one thing I'm trying to do is to bring people together and not create division and silos, because sometimes doctors think that healthcare leaders don't understand, and healthcare leaders think that doctors don't understand. So there are healthcare leaders trying to do their best, but everyone is answering to someone above them. So, for instance, hospitals have to keep the doors open, right? And then the cost of everything is going up. So sometimes as hospitals, for their answers is to have the doctors see more patients or admit more patients or do more tests. But all of this, so there's a term, moral injury. Are you familiar with that?
No, tell me about it.
Okay, so it started with soldiers like coming back from the war when they had to do things when they were sent off to war or overseas, that conflicted with their moral values. Obviously, right? Sometimes they had to kill people, and say, that's not something that they really wanted to do. So when they came back, that's one of the reasons they would have these internal struggles and internal conflicts. So that's the difference. So there's terms floating around: burnout and moral injury. So burnout, anyone can be burnout in any job. And I think we all kind of get a sense of what that is. So the difference between burnout and doctors can be burnt out, and or they can have moral injury. So for doctors, what moral injury would look like is, say, like, you went to the doctor and you were having back pain, right? And the doctor knew, like, did a scan, and for you, just know that you needed surgery. For you, that's going to be the only answer. Well, insurance might say, well, no, you have to try 6 weeks of physical therapy first. But say you had a herniated disc where it's obvious in the scans that that disc, the jelly from the middle of that disc, is out there. Physical therapy can't, I'm a physical therapist, right? If that's the case, like, I cannot help you. So then the doctor gets so frustrated because they know what they need to do to help the patient, but they're prevented from doing that by insurance. And even the same with medication, like, say, you had some issue and, your doctor just knew in your specific case, because that's what they go to med school for, what the best medication is gonna be for you. Well, sometimes they're told they have to try 2 or 3 cheaper medications before they can give you the medication you want, and sometimes they're life-saving medication. Sometimes we're even talking about cancer. So the doctors, they really do care about patients, and then they just know that you're going to be suffering and it's not going to work, and their hands are tied, and they often have to do what the lay people might have never heard of. It's called peer to peers. So sometimes they have to get on in the middle of their their day, where they're seeing, some doctors see like 40 patients a day, which is already ridiculous, and then they'll get these calls from the insurance company and they have to drop what they're doing and do what's called a peer to peer. So the insurance company hires doctors, and they're supposed to talk to your doctor to decide together, can you have that surgery? Can you get that MRI? But sometimes it's like literally, and doctors have shared this. So say again, it's the orthopedic surgeon, and they might have a cardiologist that hasn't practiced in 20 years and they have nothing to do. But then that cardiologist is supposed to deny, like, they're really, in general, supposed to try to deny it. So then the orthopedic surgeons are so frustrated. It's like, here I'm talking to this cardiologist that hasn't practiced in 20 years. They're denying the surgery that my patient needs. Plus, it spends waste so much of their time. So that's just a couple, examples from, like, doctors' perspectives, of like how they experience that moral injury. And there are some healthcare leaders that experience moral injury too. There are some healthcare leaders who do care about the people that work for them, but again, because they have to meet the bottom line, that sometimes, they're forced to make decisions and that don't feel very good for them, or that they don't might not feel are in the best interest of their employees. But I feel like everyone needs to care about each other, and I feel like if nothing changes, so the healthcare system obviously needs to change, but if nothing else changed, if everyone was kind and curious about each other, then, at all levels, so if the healthcare leaders were kind to the, doctors, because sometimes they, do see them as, okay, you're our revenue generators, just do more, and then doctors feel like cogs in a wheel. But if they really were, listen to the doctors and said, how can we support you? And then really listen, not just lip service, and then doctors with each other, respecting each other, and then also really listening to the patients, because sometimes, again, if they have this burnout moral injury, they have put up walls themselves, and sometimes they're not really and have the bandwidth to really care and listen to the patient. But then also, as you alluded to a while ago, patients, we can also be curious and wonder, well, how is your doctor doing? Or just ask them, do you have any vacations coming up? Or to let them, or to thank them, or say, I care about you too.
I have a question, and this question might be controversial, but is healthcare as a business fundamentally broken?
It is. That's what a lot of people are saying right now, that it actually is. Now, interestingly, like, nobody has the answer. And because some people in America will say, okay, well, if we have universal health care, but say you're in Canada, a lot of people in Canada come to America, like, say they really need a hip replacement, they're in a lot of pain. they have universal health care, but they might have to wait 2 years to get a hip replacement. So then those people come to America to get the health care they need more quickly. Another case I'll give you is in the UK. They also have universal health care. But again, to cut costs, that they've also been devaluing physicians, and there's literally, and if you Google this, you can you things will come up if you Google like physicians in the UK driving an Uber or physicians in the UK working in a grocery store, because now they're hiring more nurse practitioners and PAs to actually replace physicians. So patients want to see a doctor and doctors want to see patients, but they're literally being pushed out from practicing. So it's not necessarily, that the answer here in America isn't necessarily universal health care. Like, that's not going to solve all the problems. So we have to figure out really around the world, like, but there are things that are working. And in one of my YouTube channels, I interview Dr. David Morris with Jeffrey Roche. And Jeffrey works with healthcare systems around the country and around the world. And Dr. David Morris is in Ireland, and they do have somewhat of a hybrid system. So they have like as a private system, but then they also have a public system for people that can't afford it. And he spoke in that episode about some advantages of the way, not that Ireland has it perfect, but that there are some things that we can learn from the way they're doing things. So that's one thing that I feel like I need to form like an international stand up for doctors coalition or something, and just like find out, because there's pockets of things like there's something called Orchid Health, and Dr. Gabe Charbonneau is getting involved with that. He's in rural Montana, and that's a healthcare system that's really trying to take care of the people that work for the healthcare system. And if you start with that, so there are things and pockets of things being done, but we need to connect all of those and find out what's working, and just to amplify that.
Yeah, I mean, the American promise is supposed to be bigger, better, faster, stronger. How can we figure out as a nation, as a well-resourced nation, how do we figure out the best model? Because what I'm seeing right now are a lot of young doctors who are taking over TikTok, and they're doing all of these TikToks and reels that are basically saying, don't do this if you don't actually love people. Don't get into this if you are not in it for helping people, because the return on investment is no longer there. The student loan crisis, what it costs. I know several couples, both doctors,
Right.
$500,000 in debt.
Right.
That's no life. And then you're working 80-hour weeks on top of that. If you have kids, you never really get to see them.
Right.
And you're paying back these loans forever. It wasn't supposed to be this way.
Right, 100%. And so I think what I never really thought about, or I didn't even realize that the residency positions are funded like by the government. So when you go in, after you graduate med school and you go into residency, you make peanuts. Like you literally would make more working at McDonald's if you take into like the hourly rate that these. So here's these residents that literally have to go to work every day making life altering decisions, 80 hours a week, and they'd make more if you figure out the hourly rate if they were at McDonald's. So it's exactly to your point, is the average med student comes out with at least $200,000 in debt. So then when you get your first attending job, because there's also Dr. Amna Shabir, who you had, that's how I know you. So she speaks to, difficulties for early career physicians, because there's something called the arrival fallacy, where you keep thinking, okay, once I get into med school, I'll be happy. Once I become a resident, I'll be happy. And then the ultimate, once I become an attending, then then everything's going to be fine. Well, when you're a new attending, you're a new attending. And I think you feel like you should know everything. You feel like other people should know you feel everything and you should know everything. And then you have this imposter syndrome where you feel like you're walking around like just pretending that you know everything, when you don't. So that causes internal struggles. And then you're taught in residency, like never to say no, like to say yes to every opportunity. So then as a new attending, that's ingrained in your head, is to say yes to this committee, say yes to everything. And then you can be just starting out in your career and already burnt out, overwhelmed, and exhausted, and you're in $200,000 of debt. And that's what they call like the golden handcuffs, because then as an attending, you're finally making more money. But say you wanted to pivot, like for me as a physical therapist, when I got burnt out, I could just leave my job, and I did, and I could get another job. But for doctors, there's non-competes, that is a very, very serious problem, that when you sign a contract to work with, like with a hospital system, they'll say, and I don't know, it would be different in, with each healthcare system, but it might be something like, if you leave, that you can't work within 50 miles for 2 years. So they kind of do that so that you wouldn't like open your own practice and steal the patient, right? Something like that. But what it does is then that changes the life of your whole entire family, because then you're either stuck there at a job that can be sucking your soul. But if you want to leave, then say you have young children like you do, right? Like say you were a doctor and found yourself in that situation. You've got great little kids, and everyone might be happy where they live. So there's sometimes they don't see any options. And all of these things that I'm talking to you about can all be reasons and contribute to doctors taking their own life. It's just there can be so many things over so long, and they can also be predisposed. Like, doctors are human too, and they're no less likely than any other human to have anxiety, depression, to have family members with addiction problems, to have divorce in their family. Like any problem you have, your doctor has it too. And as Dr. David Alfrey has said, I put my pants on the same way you do. So, but they feel like, as a doctor, like you feel like you have to put forward this perfect image, and you can be falling apart inside, but have like shame and not feel comfortable reaching out for help.
Yeah, that's so hard. And one of the things that stuck out to me in my interview with Dr. Shabir was that very thing where she said, I realized I needed help. And I firmly believe that we do not get through this life alone. It is in the context of community, it is with others. And when it comes to a job like a doctor, I always ask the question, for those of you who provide care for others, who's caring for you? Because without that, what do we have? I love the line you said earlier, when the doctors are well, I think everyone is well. Is that what you said?
Yeah,
That,
everyone wins, and that's from Dr. Kathy Stepien. Everyone wins when physicians are well, and that's 100% true. And I'd like here to give a shout out to the Dr. Lorna Breen Heroes Foundation. Dr. Lorna Breen was a ER physician working in New York City during the pandemic. So tireless hours, from like that do 12-hour shifts, and then more people were, coming, and that just stay on because some of the colleagues would get COVID. So then it was less and less doctors doing more and more of the work, and you're trained to save people, but people were dying in front of you in the hallways, in the bays in the ER, and there was so little you could do about it. And so she developed COVID, and then you had to take a mandatory 10 days off. So she went back to work when she wasn't physically or emotionally ready. And again, back to doing 12-plus hour shifts. And I think her body just gave out, and she ended up in a practically catatonic state in her apartment. She called her sister in Virginia. They got a chain of people, because again, that's when like New York City was kind of closed down, right? And it was before the vaccines, right before the vaccines. So they got her to her sister in Virginia, and they got her to an inpatient like psychiatric unit to help her. So when she was doing a little better, whether it was a few days later, I don't know the exact period of time she got out, but there's real and perceived obstacles to doctors seeking help. And one of them is like on my PT license on the back, I have to say that whether or not I was like convicted of a felony in the last year, like things like that. There's nothing about my mental health. But for doctors, nurses, pharmacists, they actually have a question like, have you ever sought help, for mental health reasons? And sometimes if you check yes, there's extra barriers to you getting employment or getting a promotion. And sometimes you have to prove things or then share it goes against the American with Disabilities Act. And it's like, so the Dr. Lorna Breen, so basically, so Dr. Lorna Breen was afraid that everything she worked her whole life for, that she was going to lose her job, and her doctor identity was everything, and she took her own life. And the sad thing is New York had already removed those intrusive questions. And so it's horrible. But her sister's husband is Corey Feist, and the two of them started the Dr. Lorna Breen Heroes Foundation, and they're trying to remove those intrusive questions in all 50 states. And just in a few years' time, they've made tremendous strides. And there's also formed this all-in for healthcare well-being initiative. And the tagline now is, health workers have the right to. And that means that they have the right to confidential, mental health, and just the supports that they need to be well.
It's so sad because it contributes to the low psychological safety that doctors will feel, where you've got all the student loans and you're finally making money. And now if you admit that you are human,
Right.
all of a sudden that could mean you lose everything. And then what do you do? Insanity. Before we wrap up, just tell me a little bit more about the book, some of the doctors who contributed, the purpose behind the book, and where people can find it.
Sure. So it really is a beautiful, cause so these were some of my first, I'd say, LinkedIn, doctor friends who wrote these chapters. And Dr. Todd Otten writes, "Purpose to the pain, connection mitigates trauma." And so I share my story in the first chapter, and his is the first physician chapter. And he was one of my first connections on LinkedIn, and we were both at a crossroads. He wrote his own book, Ripple of Change. He ordered with his patient Joshua Judy, because he had ordered a medication, and that he had even taken himself, but his patient suffered very significant side effects. So the patient was traumatized, but Todd was too. Here he's just trying to help people and knowing that. So they ended up writing a beautiful book together about, the things in the system. So then I met Todd, and we were both kind of at a crossroads because he had been burnt out from his job, and we were both, and I wanted to help doctors. So his chapter is really beautiful because it kind of shares both of our stories and our connection. Again, how connection mitigates trauma and what we're both doing to move the needle. And another powerful chapter is Dr. David Alfrey is a retired anesthesiologist, and he wrote a book, Saving Grace: What Patients Teach Us About Life, Death, and the Balance in Between. And that's a beautiful book. But what he shares, not in his book, but what he chose to share in this book, is about anesthesiologists. And his chapter is titled "You Saved My Life: Challenge of Substance Use Disorder and Anesthesiologists, Highlighting Risk for All Doctors." What the population would have no idea is anesthesiologists have the highest addiction rate of any specialty in medicine, because they're constantly around the drugs and have the means and access and know how to do it. And he shared, that one doctor told him that, again, ended up having to go into a treatment program, that he was like in a kid in a candy store. And I said to him, I said, there should be a warning. Like, if you choose that as a specialty, just like there's a warning on a packet of cigarettes, that they should be telling these young residents, and almost they should all get like therapy or coaching or have classes to help them, assure them up, to prevent this from happening. Because then what happens is people might not know. So for instance, me as a physical therapist, I was trained as a general physical therapist. So then I could change, I could work in pediatrics, and then I could get my own education, and then I could work with older people. But if you go to a few years of training as a residency as an anesthesiologist, so say you get addicted to the drugs and you have to go through a treatment program, when you come back, the rate of recurrence is sadly very high because you're still around the medication. So, but then if you say, okay, this isn't going to work for me, I'll be a pediatrician. You can't. You would have to go spend hundreds of $1,000s more and do a whole other residency. So again, there's other doctors that take their life then because they feel trapped. So that's the only other one I'll share you for the sake of time, but that's just one, and there's just beautiful. And I'll just say that another title is The People's Pathologist: Reclaiming Humanity in Medicine. And Dr. Alette Kawam is a young pathologist, and she wants to be known as the people's pathologist. So every chapter is beautiful. And this book is available on Amazon through a paperback and Kindle versions. And I can send you the direct link to the book. And we would really appreciate it. Again, if you're a doctor or patient, I think you'll love the stories. You'll appreciate it. And I guess the reviews really help the book reach a wider audience, because now I am like my LinkedIn friends. But if we want this, to have ripples of change throughout the world, would really appreciate after you read it if you could give us a review on Amazon.
Yes, I will leave a link to the book in the description, in the show notes for this podcast. People, get this book, go read it, support your doctors. Kim, before we go, what are 2 ways that people can support their doctors right now?
Well, thank you very, very much for asking that. And the biggest one, so Doctor's Day is March 30th. I say that any time is a good time to thank a doctor. So this year I tried to make a big impact where people thank their doctors on Doctor's Day. But any time. So even now, like say you had an appointment 6 months ago and there was something that you remember, wow, my doctor really took the time to listen for me, or he ordered that test that I really needed to improve my life. So just thanking a doctor in whatever way that means to you, whether it's in your visit at the end, like just like really looking them in the eyes and saying, thank you so much for taking the time to help me or to listen to me, or sending a written thank you note, because many doctors have told me that they've saved every card or letter, a gift, anything that a patient has given to them, and that they have it in they all say, like, I have a folder or a drawer in my desk. And when the times get hard, they take that out and look at it, and you'll never know. And actually, the last time I talked to my doctor, I was at the beach and he called to thank me for my thank you note. And so I think it meant so much to him. And he actually said, patients like you are the reason I'm continuing to do this. I'm sorry you're going through all this, but I'm looking forward to seeing you again. And those are the last words that I ever heard from my doctor. So it can make the biggest difference. So I would say that. And then also any little way that you can advocate, even ask it, check in with your healthcare system or something, like, what are you doing to make sure that doctors feel supported? Or find me on LinkedIn, because again, I'm trying to figure all of this out. And there's a lot of us, there's a group of orthopedic surgeons that are trying to figure out, how they can change things. So there's people out here. And if you want to, find me on LinkedIn, that I can connect you with people that you would want to have and if I talk to somebody, I know who they want to be connected with.
That's good. So thank your doctor, advocate for your doctor. Kim, thank you for joining me on this episode of Tell Me More. And thank you for listening, watching, however it is you're consuming this content. Drop something in the comments, or maybe a review of something you learned today, a way in which you want to now show up for our care providers in this world. And I'll see you next time as I ask you to tell me more.